Despite facing challenges these days, people with HIV are living happy and productive lives, all thanks to treatment, research, and awareness.
Florida has one of the worst records right now for HIV cases. Last week, news broke Senator Rick Scott blocked federal funds to fight the state's HIV crisis during his time serving as the state's governor.
While this may seem like a setback, there is a health center right here in Central Florida that continues to get results in the fight against HIV.
And joining us now, Hope and Help's Development and Communications Director Joshua Myers. Good to see you again. Thanks for being here.
Thank you so much for having me.
What can you tell us about how this is impacting Central Florida with this funding news or lack of funding thereof? Because it's a little complicated.
Well, we were shocked at Hope and Help, especially given that Florida is #1 for new HIV transmissions yet again. So a couple years in a row, we have 4 cities on the top 10 list nationally. So that just puts Florida right there. And to learn that nearly $70 million in funding was, just kind of whisked away, it was really saddening. But there is hope. There's still treatment services available at Hope and Help. We have a great donor constituency and supporters like a New 6 as well, who help us thrive and address this issue.
And we love the Hope and Help Center. You guys do so much amazing work for the community. Tell folks who maybe aren't familiar what services they can find at Hope and Help.
Absolutely. So we have free HIV testing. We have free HEP C testing and free syphilis testing. And there's also STD treatment and testing services. We have what's called an all-inclusive service, and what that means is that for people who are living with HIV, sometimes they have to, take a 2-hour bus ride to get from one part of town to the other part of town. They have to go to another part of town to meet with their primary care doctor, then they have their infectious disease doctor. We have all that in one location, so it's very convenient for our folks. So they get the treatment that they need for HIV, and they also get primary medical care.
And what are some of the ways you're trying to, help people to spread awareness to help combat the spread of HIV right now? Because there are some things and educational tools available that some people are still learning about.
Still learning, that's key. But right now we have a campaign that's called Choose to Protect, and there's 4 main tenets of that. There's talk, test, condoms, and PrEP. And basically with the talk portion, we're encouraging everyone to talk about HIV, to talk about safer sex with your family, your friends, your children, your parents, your religious community, your medical provider. And once we start the conversation, we generate awareness. And then we're encouraging everyone to get tested. The CDC recommends that everyone get tested at least 1 time a year if you're active. And for those who might have multiple partners or might be a little bit more active or not in a monogamous relationship, you might want to get tested maybe 2 or 3 times a year. And then there's also different types of condoms to use. We encourage people to learn about the different forms out there. There's flavored condoms, there's large, small, rib, smooth, female and male condoms as well. So we want people to learn how to use them consistently and correctly. And then the last thing is we encourage people to learn about PrEP. PrEP is PreExposure Prophylaxis, and that's a once-a-day pill that you take to where it's up to 99% effective at stopping an HIV-negative person from becoming HIV positive through sexual contact.
I feel like so many people still don't know about PrEP. I feel like, there are certain communities where it's more prevalent, but, when I've mentioned it to people, so many people are like, what's that? Why do you think a lot of people just don't know about some of these things?
Well, it's a relatively new drug. I think the manufacturers are starting to beef up the marketing for it. We have a program at Hope and Help called PrEP Plus, and we take care of all the enrollment for you. So within 72 business hours, you'd get your medication in hand after you go through a series of questions. And just we want to determine if this is the best fit for you.
And when we talk about, who's affected by HIV, there's a lot of misconception there as well, because some of the fastest growing groups are, not necessarily gay or bisexual people. It may be women, it may be women of color, it may be the senior category. Talk to us about that.
Well, the rates are growing all across the board, unfortunately, but what that might mean is that we're doing a little bit more testing in the areas, and we're finding people who are living with the disease and getting them into treatment. But right now we have black men, Latino men, black women, Latino women who are at the forefront of this disease, also trans black women as well. And the reasons for the high transmissions in these groups are many. We could spend all day talking about that. But the point that we want to get across to folks is that they need to get tested. Once you get tested, you become aware. of your health. You become more aware of your health status and what you're able to use with all these different resources and options available to help you.
And I think sometimes people are nervous to get tested, but you guys make it very quick and painless.
Absolutely. It's a 15-minute or less test. You find out your results right then and there. And the wonderful thing I love about our organization is that if you do test positive for anything, we don't just leave you to your own vices. We connect you immediately. So that means you get a case manager to help mitigate any issues that you might have living with the disease. So if you're experiencing homelessness or if you have food scarcity, et cetera, we address that immediately so that you can stay in care and get treatment.
So before we go, for those who know someone who may need some hope and help, or you're looking for it yourself, how can we get in touch?
Give us a call, 407-645-2577, or visit us online, hopeandhelp.org. And we just moved to Winter Park, so we're 4122 Metric Drive, right behind the Siemens building.
All right. Thank you so much.
Thank you, ladies.